Okay, so the next thing we'll talk about is beta thalassemia. This is also an autosomal recessive disorder with reduced expression for heterozygous, so similarly to sickle cell. This is mostly seen in patients of Mediterranean descent. So beta thalassemia is also called Cooley's anemia, and what happens is there's a problem with hemoglobin synthesis. Hemoglobin is not synthesized properly. That makes the red blood cells easily broken down, and that causes severe anemia. So they make red blood cells and they break them down, and they make them and they break them down, and they break them down almost as fast as they can make them, or faster. So because they're continually making red blood cells, but they're continually very anemic, several things happen. The bone marrow is trying desperately to keep up. So we know that it's going to release immature red blood cells, reticulocytes, right? But also that bone marrow will grow because it's trying desperately to keep up, because as fast as it produces red blood cells, they get broken down. So that bone marrow growth causes extreme pain and eventually fractures in those bones and deformities, okay? The patient is severely anemic. So they have cardiomegaly that develops from heart failure. They have enlarged heart, enlarged spleen, enlarged liver, okay? It slows their growth, and the spleen may actually break down their red blood cells faster. So one of the most important pieces of managing this is to give transfusions frequently enough to prevent the anemia from becoming so severe that it breaks and deforms the bones, okay? We want to prevent the bone marrow from having to overgrow. So all of those repeated transfusions mean lots and lots of iron, and that iron can be stored in organs that's called hemosiderosis. So for diagnosis, this may not be recognized until late infancy. What would be seen is severe anemia, abnormal morphology. That means when they look at the red blood cells on a slide, they're going to see abnormal cells, and reticulocytosis, because they're trying to release enough red blood cells and they're sending out the ones that aren't grown yet. Management: this patient needs regular transfusions to keep their hemoglobin over 9.5, because that seems to be the level that prevents bone marrow expansion. They also, because they're going to have too much iron from all those transfusions, they need chelation therapy. If the spleen is severely enlarged, it will be removed, so splenectomy. Remember what they have if they have a splenectomy. What is their lifetime increased risk? It's going to be sepsis, okay? So education and support. We need to make sure the family understands the pathophysiology, treatment, and prognosis of this disease. They need some genetic counseling, because again, 1 in 4, if both parents have the gene, 1 in 4 of those children will have this disease. And we need to give lots of patient and family emotional support, okay? Most patients with beta thalassemia survive well into adulthood. The most common causes of death are heart disease, sepsis because the spleen's been removed, or organ failure. And again, this can be cured by stem cell transplant, okay? Next section will be aplastic anemia.